Have you tried to make a vet appointment recently? I don't know about your area, but in my neck of the woods, it's a lot of work to get an appointment around here. You have to plan ahead. Now, I hope your puppy is healthy and happy, but if you're seeing some behavior that concerns you, today's video might guide you on whether it's time to make that call to the vet or not. Now, keep in mind, I am not a vet. I've worked in a vet's clinic, so I am definitely familiar with the medical side of canines, and I have 3 dogs who've had their fair share of medical issues. I'm also a certified trainer, so I do understand dog behavior as well. I am qualified to give you a few tips that can help you determine if something is fishy or if something else is going on. Number 1, eating and drinking is off. Now, this is usually the first sign a dog's going to give you that something is amiss in his body. And if you're keeping a good log or puppy journal and feeding on a regular schedule, like we suggest, this will be much more obvious. That's one of the benefits of keeping the log. Did you know that dogs need an average of 1 ounce of water per pound of body weight to stay hydrated? Now, that's just a general rule of thumb, and a lot of activity and a warmer day could mean he needs even more. But if you're concerned that your dog isn't getting enough water intake, you could measure it to see how much he's drinking. This is also great information for your vet. Number 2, your dog seems lethargic. Now, this is a hard one because puppies sleep a lot, and they can have off days too, just like we can. Growth spurts can slow down energy for some days, or overstimulated days usually lead to days with more naps. But if you're seeing an extreme decrease in energy and a lack of interest in things that your puppy usually loves, it's time to make the call to the vet. Number 3, you might see the opposite of lethargic. Hyper behavior or more energetic than normal. Now, this will definitely be hard to figure out, especially if you have a really energetic puppy. But dogs don't show pain and discomfort in ways that we would expect. So if you're seeing a big change in behavior and there's not really a known reason for it, pay attention for more clues that he's struggling with something medically. Number 4, pee and poo changes. Now, I'm sure you don't want to watch your dog take every single potty break, but I think you should. I actually recommend that you go out with your dog for all potty breaks, even as an adult dog. Many medical issues show up first in your dog's pee or poo. Now, you're gonna notice color changes, consistency changes, even a struggle, or some change in the frequency. These are all good things to note and keep a log of for your vet if your pup ends up having a medical issue. You might even have to take in a sample of poo. Be sure to talk to your vet about the best way to store it so the lab tests are accurate. Typically, they recommend that you store it in a refrigerated or cooled place. Number 5, growling when you attempt to touch. Now, this could mean that your dog is sore in areas that you were touching. We always want to listen to a growl because it's the dog's way of communicating with us. And if we don't listen, they might have to escalate to a bite. Sometimes insect bites or scratches are hard to see with all that fur. This is also a good reason to keep up with the positive body handling sessions. So when it comes time to the exam for your dog, he or she is going to be willing because you've practiced it so much. Check out the best ways to do that in this video. You should be checking for fleas and ticks on your dog. That could happen even if you live in the city. All right, number 6, limping. Limping is one of the more obvious signs that there's pain or discomfort. Humans usually pick that one up pretty quickly, but it's probably not the first sign that your dog's given that something's wrong. It's hard to know why the dog is limping, but the vet can help you out with that. Dogs can pull or strain muscles too. Or maybe he has a thorn or a pebble in his paw pad, or something's bothering his nail. Try to think of any places he's been where he could have stepped on something painful. Now, this could be broken glass out on your walk. This information is going to help your vet troubleshoot too. Number 7, hesitating before acting, especially if he's used to doing this behavior with no issues. If your dog seems hesitant to do things that used to be pretty normal for him, this could be a sign of some aches and pains. This includes jumping or going upstairs or even going potty. Hesitation might look like some ears pinned back and even some side eye contact with you. This is his way of saying, something isn't right, maybe you could help me out. Now, I humanize that there, but I think you're gonna notice if you're paying attention to that canine body language. It's like a whole new language, so I do suggest you study up on it if you have a new puppy. Now, my 30-day to puppy perfection course has a whole lesson on body language that my students love. And if you're already enrolled, just head over to the bonus section to find those lessons. Number 8, inability to settle or showing discomfort or agitation. Now, if your dog seems like he's having a hard time settling down, especially when it's his normal sleep time, this is usually a sign of something that's bothering him. Now, my teammate Allison recently had a few sleepless nights with Lincoln. He's normally a world-class sleeper and snuggler, but these nights he seemed to want to sleep, but he couldn't get comfortable. He just kept moving around. Now, Allison said that he slept on the floor instead of with her, which he's never done before. Now, with some puppy detective skills, we figured out that Lincoln had gotten into some human food in the teenager's room, and he was struggling with an upset stomach. It actually took a few days to pass, but now the puppy proofing to the teen bedroom has been kicked up a notch, and Lincoln's feeling much better. Dogs can get heartburn and indigestion too. Number 9, excessive thirst. Now, if your dog seems to be drinking a lot more than usual, this could be a sign of an issue. Of course, this might just be an active day or food that makes him thirsty. I'm looking at you, bully sticks. But it's something to note along with all the other signs. Now, a lot of these signs are things that on their own might not be a big deal, but with other symptoms, they could be worth a call to the vet. Number 10. Vomiting. That yellow foamy bile that happens sometimes is usually a sign that your puppy's stomach is empty, and you might want to offer a small snack a little more frequently. But if your puppy is throwing up undigested food or food in general, it's time to keep a close eye. Now, you might want to restrict his freedom so he can't sneak off and throw up somewhere that you don't notice. The amount, the consistency, and the ingredients in the vomit can tell you a lot, as well as the time when it happened in relation to the time your dog ate. Now, you might want to snap a picture of it to show your vet. The bottom line is this: you do know your dog best. You are his advocate to the doctor, so it's best if you pay close attention and provide your vet with as much information as you can, and that's going to make their job easier. Now, one of my students, Peg, keeps detailed logs of her dog's eating, drinking, and pooping and peeing habits. When Bitsy had a medical issue, this detailed log enabled the vets to rule out a number of issues and avoid costly lab tests. That made Bitsy, Peg's, and the vet's life easier. Now, another thing to make your puppy's life easier is to keep up with the recovery cone desensitization. So even if spay and neuter surgery is all done, it's still good to put the cone on your dog once or twice a week and offer up some tasty treats. This is going to help your dog tolerate it when you have an unexpected medical issue. Now, if you're not sure how to get your dog to love their cone, I've got you covered. This video is going to get you there. Now, I hope your pup is 100% healthy, but if you notice some signs of illness before calling the vet, what were they? Share in the comments below. I hope you enjoyed this video with more helpful puppy raising tips. You can show your love by subscribing to the channel, and you could give us a tip using the Super Thanks feature. Alright, until next week, this is Michele Lennon, your certified trainer and puppy expert, signing off.